Testosterone pellet therapy keeps coming up a lot lately. So here's the deal with pellet therapy and why I don't do it. In pellet therapy, tiny pellets like little grains of rice are installed through a surgical procedure into your buttock area. This is an invasive surgical procedure which is performed every 3 to 4 months, which carries its own risks and drawbacks. From the surgical incision to the insertion of this large needle-like thing called a trocar into your body, which is used to insert the pellets there. This procedure leaves a significant amount of scar tissue for one, especially given the fact that testosterone therapy will be something you're doing for years, or as long as you want to feel the benefits from it. So it requires periodic, routine surgical procedures. The other aspect is the therapy itself is suboptimal. There is a build-up period to feel the effects of testosterone over 2 to 4 weeks, followed by 2 to 4 weeks of feeling good, followed by 2 to 4 weeks of tapering down. So what you get out of the 3 to 4 month period, you're experiencing this roller coaster ride of enjoying high levels of testosterone, followed by a gradual and continual decline in your response until your repeated surgical procedure happens again. I get the concept that people like the idea to, quote, set it and forget it, which makes it appear super convenient. However, with pellet therapy, you will trade feeling optimal all the time, always, for maybe occasionally feeling that way. The other significant aspect which makes this a failed therapy is that once these pellets are installed, your dose is set. You can't change it. If you experience effects of too much testosterone, you're locked in until your next surgical procedure. If too little and not enough symptom resolution, which is the point of any therapy anyway, you're stuck. You're stuck struggling with that whole thing again until your next surgical procedure. And lastly, for me, this is an ethical issue. To be quite honest, I am more than qualified to perform this procedure, but I choose not to do it because it does not offer the best therapy for my patients. It's a great moneymaker from the provider or from a business point of view because of the significant upcharge of the product and procedure. However, I don't provide this therapy because it does not mesh with my ethics. The only time I would say pellet therapy could be viably used is if you're deploying to an active war zone or you're going to prison. So unless one of those situations applies to you, do yourself a favor, stick to one of the viable options for your testosterone therapy, which are transdermal cream or injectable therapy, so you'll feel and be your best.